Hello again. This is Dr. Mo. I believe this is my 5th lecture that I've given. Hopefully you, as my patients or as Dr. Kilgore's patients, have watched and gotten something from the other lectures. Today I want to talk about, just probably off the cuff, a little bit more about some of the expectations that Dr. Kilgore and I will have for our patients, and kind of clarify some positions and make sure that everyone's on the same page with regards to me prescribing, or Dr. Kilgore prescribing Suboxone. So the first issue that I want to discuss is that you are in a program because you came to Dr. Kilgore, Dr. Mo, myself, for treatment of an addiction, and namely an opiate addiction. Because of that, we are allowed to prescribe you Suboxone. So my concern has been that I have noticed over the last several months that a lot of the drug screens that I've been doing are positive for other substances. Some of the substances that I'm seeing is marijuana, other opiates, benzodiazepines, amphetamines, alcohol, and to me this is somewhat disturbing because, again, what we're trying to do, what we like to do with our clients is to provide a lifestyle in which you are not using other drugs of abuse. I believe that these other substances that I just mentioned are drugs of abuse. People abuse them and get addicted to them. They form relationships with them. They're difficult to give up. There's 100,000 reasons why somebody will say why they continue to use these other substances. I've heard it 100 times, and I'll probably hear it another 100 times. But the bottom line is that if you're in treatment and you're trying to get better from an addiction, it does not make any sense for you to use addictive substances. And let me just be clear once again, this includes alcohol, it includes marijuana, it includes benzodiazepines like Xanax, Klonopin, it includes amphetamines. I don't care if they're prescribed to you or not. This includes, of course, cocaine, it includes heroin, methamphetamines. It's just not acceptable. Not acceptable at all. And here's what I'm asking, is that if you are truly struggling with your addiction, and that's why you're using these other substances, then talk to your doctor about that and come up with a real treatment program for yourself. You may require more treatment than can be offered in an outpatient setting that you're enjoying quite honestly, somewhat of a luxury to enjoy coming to a doctor's office and seeing somebody once a month for your medication. It's really not going to work if you continue to use on top of the Suboxone. So if that is what your intent is, I would like to know it so that we can just go ahead and part ways. If your intention is to continue to use other substances while you're on Suboxone, let me know that, be upfront, be honest with me, no hard feelings, but we'll just go our separate ways. If your intention is to really get all those other things out of your life, I understand there'll be setbacks, and I understand that it's not always so easy as just to say I'm done, but I want to hear then what you're doing to help yourself accomplish the goals that I've talked about already just now. What are you doing to get the other substances out of your life? And if you're not doing anything, then ask yourself, why am I not doing anything? Ask yourself, how important are those things to me, and why do I continue to do them? Hopefully I made myself pretty clear. I don't want to see them in your system. I think they're dangerous. I think they're dangerous to be doing on top of a medication that I'm prescribing. And the bottom line is, it's just a continued part of your addiction. And that's why, I think you're here seeing me or Dr. Kilgore's to try to become in recovery. So that's the main thing that I really want to discuss with you, is that, you know, there are a lot of people that call my office and Dr. Kilgore's office every day asking to be in our program, and we unfortunately are limited by a number as to how many people we can treat. And I'm at the point now where I really think that you need to show me that you're serious about your recovery, and if you continue to use, then I would want to offer a spot to somebody else that may actually be taking their recovery a little bit more seriously than you are. Now, I know that this lecture, this little talk, may not be really relevant to some people who are doing well. And if you're watching this, I really want to congratulate you on doing well, and I want to say to you to continue to work at that and keep doing well. But if what I am saying is applying to you, I'm just giving you fair notice, is that, you know, there is a time where I would determine that treatment is not working for you and decide that, you know, our relationship would need to end. It's not that I want to do that, it's not that I do that on the first time somebody tests positive or what have you. But I just want you to understand that there's a lot of people that need treatment, and I just want to see that people that I'm treating are taking it seriously. If you're testing positive, I want you to understand that what I'm going to be asking from you is to see me more often, do more drug screens, and really show me that you're serious about your recovery. Again, that's going to cost you more money, and I'm again giving you fair warning, is that's not my goal. My goal is to get you into a place where I really feel like you're doing well. So those are some of the things that I want you to understand will be happening if your drug screens are positive. The other thing that would be appreciated is that you show up for your appointments every month. This is what I need you to do. This is again a program where if you're stable, I see you once a month. I don't see you once every 6 weeks, once every other month. I see you every month, and that's a very important part of what we do. The other option would be to go to a methadone clinic. I'm the medical director of a methadone clinic, and the people that are in the methadone clinic go there every day. So they're required to come in every day of the year and dose at the clinic. And again, I'm saying this to you is because I want you to understand that if you have a spot in a Suboxone program, that's really an important thing to have, and it's somewhat of a privilege almost to have that, because I know how difficult it is to find spots in Suboxone programs. And so what we're asking for is for you to take into consideration some of the privileges you have that maybe other people with the same diagnosis don't have, that are going to a methadone clinic where they go in each day. So if I'm asking you to see me once a month, I don't feel like I'm asking too much from you. The other piece of that is that if you have an appointment, it's always appreciated that if you need to change that appointment, that you would call in advance and try to do so. And that if I need to change an appointment, you know, I'll apologize about that, but I'll always try to call you and let you know in advance, or my office staff would call you and let you know in advance. So, you know, we always are trying to work with each other. We know that everything doesn't always work out just perfectly, but, you know, courtesy is to call if you are going to change your appointment time. And the other point is to try to be on time for your appointments, because I'm busy, Dr. Kilgore's busy, and we really need for people to take responsibility for when they're going to be at their appointments and be there on time. Know when your appointment is. If you don't know, you know, get on the phone and call and find out, and be there on time. We've always been trying to accommodate when people run late, and I understand that that happens sometimes, but when it becomes a pattern, it becomes a problem, you know, it's somewhat disruptive of the day when some people miss their appointments or show up an hour late or a couple hours late and then expect to be seen that day. So these things I think we all can try to work on and improve on. The other thing that I need to mention is that it is part of your responsibility to pay your fees on time. I know this isn't the most pleasant topic to talk about. Times are hard for a lot of people, and I understand that. But again, I think that it is just part of someone's responsibility to make sure that that is not an issue in your treatment, that you're paying, that you stay current with your payments, and that if that's a problem, then we need to maybe talk or seek out other treatments for you that may be more affordable. I understand this is expensive, I understand the medication's expensive, but it's still part of the requirement for you as a patient to stay on top of that. The other issues that come up frequently in the program would be if you have certain insurances that need prior authorizations or things like that. Again, you're an adult, you have to be responsible for letting our office staff know in a reasonable amount of time that is going to be needed to be done. So the other thing about that would be if you are with certain insurances and get prior authorizations and your medications get paid for, there are certain things that they'll ask us from my office to send in so that they can do a prior authorization. And some of those things that they'll ask is that they want negative urine drug screens, they'll want to know if you're in counseling, they'll want to know if you're involved in your treatment and coming to your appointments on time. They'll look at Inspect, which is the pharmacy's way of letting doctors know what controlled medicines have been filled by our patients. So all these insurance companies can review that as well and see if you're getting other medications from other providers, or if you're taking things that's not supposed to be taken while on Suboxone. And the most common thing that may be prescribed to somebody that you should not be using while on Suboxone are benzodiazepines. So again, those are Xanax, Klonopin, and those sorts of things. Of course, other opiates or other Suboxone, if you're getting Suboxone from another provider or getting other opiates from other providers, all those things are red flags, and we'll find that out. So just so that you know about that. Another issue that I want to make sure that I discuss with you as well is that if you are using other substances while you're on Suboxone, and let's say that I do a drug screen and it's positive for marijuana, or it's positive for a benzodiazepine or another opiate that's not been approved by me, I want you to understand that if you were to drive while on Suboxone and taking other substances, that's a dangerous thing to do. I have no way of knowing how you may be affected by that. I'm telling you, under no circumstances would I ever recommend that you drive or operate machinery if you're mixing Suboxone with other substances. Of course, the way we kind of think about that a lot of times is that, well, I'm okay with that. It doesn't impair me. It doesn't sedate me. There's no problems. However, it only takes one poor decision or one accident to happen where, you don't want to be in that situation. I don't want you to be in that situation where you were taking something that was not approved to take and got behind the wheel and something bad could happen. So I want you to be very clear that if your drug screens are showing that you're on other substances, I'm telling you, you should not be driving at all. I want you to understand that and know that, and that's my recommendation. I think that it's just not advisable and it's dangerous to do those sorts of things. And I would include alcohol, marijuana, and all the other illicit drugs, and also anything that may be prescribed to you that could be sedating while you're on Suboxone. Those are some of the issues that I wanted to talk about. I really hope that it didn't even apply to you. But if it does, what I'm asking is that you talk to Dr. Kilgore and myself about what's going on. I'd much rather you talk to me about things than I find out through a drug screen or something like that, and then have to call and talk to you about what's going on, and that I need you to be open and honest with me about what's happening with you. If you can do that, then I'll be happy to be your provider, and I think that we can work well together as long as we have that open kind of relationship where we're talking back and forth about really what's going on. Be happy to answer any of your questions if you come back in to see me. If you want to talk about this lecture or any of the past lectures, about my expectations and what we are wanting from you, I always am happy to have those kind of conversations. So thanks again. Hope you're having a good day, and I'll be talking to you soon about another topic.